Well, I look at the neck as an appendage, so I look at the head as part of that. The idea kind of started when at a Professional Hockey Chiropractic Society program, we had a gentleman from, I believe he was from the Montreal Canadiens. He was their strength and conditioning guide, and there was a great deal of attention preseason to hip function, to knee function, to shoulder function, strength and application and balance and coordination, but nothing to the neck, nothing to the head, nothing to help them prevent concussions, nothing to increase strength of the cervical spine, yet their incidence rate was in the 30 to 35% of the players. So it led me to also look at the fact that most of our neck strengthening programs isolate the neck. We do resistance. We do an isometric resistance. We may use a band and just walk away from the band and just try and get some resistance in the cervical spine. What I did is I looked at that in order to strengthen an extremity, whether it's a shoulder or a hip, well, there's a great deal of attention given to core stabilization. So bringing the core into it through reflex locomotion. When I lie supine, I've got to have a good activation of my upper trap to allow for elongation of my spine, to allow my abdominals to activate, to create elongation in me. And then I would use some deep neck flexion. I would use some support through the hands. I would use that with some, and get the whole of the core involved. We put patients in sideline and evoke support on a shoulder, support on a hip, and then move the neck into lateral bending or rotation. We would use a quadruped position and then use the bracing of Brunko to create a posterior pelvic tilt, engage the abdominal wall, retract the head, and then bring us into extension. So we would do a whole variety of things like that with, again, isometric holds throughout the stabilization of the core of the body, while then moving the neck, giving the base of the neck a better support point from which to then create support and strength when we have an impact. We get hit and we're going into the boards, we fall on our back, when we bounce our head off the floor, we try and avoid these kind of actions.
Training now.
Adding the eyes to the movement, which is really a natural thing because of the planned movement and the fact that the eyes are involved. Yes, I think that adds it. We can add a little bit of tongue pressure. That adds some deep neck flexor strength. So we can get into some of those things, but when we start and teach the basics, we want the athlete, the participant, the patient to get a foundation first and then expand to them. It's like anything. If you give too many cues, too many activities, too many things to do, at some point they're going to get lost. So we would build on it. But yes, we would use a lot of the visual cues, the visual enhancements, the tongue enhancements, the pelvic floor enhancements, a variety of things to incorporate the whole of the body into the neck strengthening activity.